Hi, I'm Dr. Aaron Greenstein. I'm a geriatric psychiatrist and dementia specialist. In this video, we will review a BrainCheck Assess report where the patient performs normally on memory tests, but shows deficits in other domains of cognition. In this case, you'll notice that both memory tasks fall into the unlikely impairment range, while the rest of the domains of cognition fall into the likely impairment range. This pattern is known as non-amnestic cognitive impairment. This pattern may reflect early dysfunction in the frontal lobes, basal ganglia, or white matter tracts. It is commonly seen in conditions such as vascular dementia, dementia with Lewy bodies, frontotemporal dementia, and late life depression. This pattern can also be present in Alzheimer's disease. Environmental and emotional contributors like sleep disruption or sleep apnea, stress, medication side effects, or substance use can also impact these cognitive domains. When you see this pattern, first screen for reversible causes of memory loss, such as depression and anxiety, using tools like the Geriatric Depression Scale and GAD-7. Next, assess the functional impact of these cognitive changes. IADLs, or instrumental activities of daily living, are tasks that we learn to complete as teenagers and young adults, things like driving and paying bills. ADLs are basic tasks we learn as children, things like bathing and getting dressed. Formal ADL and IADL assessments are available on the BrainCheck platform. The patient's functional status in combination with BrainCheck Assess performance will allow you to stage the patient's dementia or determine if they have mild cognitive impairment. If your patient has IADL limitations only, then they likely have mild dementia. If they have 1 to 2 ADL limitations, their staging may be moderate. If more than 2 ADL limitations are present, their staging may be severe. In cases of non-amnestic memory loss, you should consider continued management of vascular risk factors, such as hypertension, hyperlipidemia, or diabetes, evaluating for delirium, neuroimaging and other workup, completing cognitive care planning, which is available on the BrainCheck platform, and if you're a primary care provider, consider a referral to a neurology or memory clinic to definitively establish a diagnosis and rule out reversible causes. This non-amnestic impairment pattern requires a broad lens, examining mood, lifestyle, vascular risk, and functional capacity to understand whether the cause is reversible, progressive, or multifactorial.